13 crucial skin signs of diabetes. 13 skin clues you shouldn't ignore. Could diabetes be speaking through your epidermis? Have you ever considered that your skin may be attempting to communicate with you beyond its visible surface? A shocking 25% of diabetics are diagnosed as a result of skin problems. Today, we'll look into the 13 most important skin indications that could indicate diabetes. Don't pass up this opportunity. Your skin could be telling you something important. Starting with number 13, eruptive xanthomatosis. This somewhat uncommon skin disease has been associated with patients that poorly controlled diabetes. These lesions, distinguished by elevated bumps, commonly appear in the buttocks, upper thighs, insides of the elbows, and behind the knees. They may also appear on the arms, legs, and shoulders. These pimples are often itchy and have a crimson perimeter with a core yellow tint. While these lesions are not hazardous in and of themselves, their presence can indicate that your diabetes management needs attention. Spotting number 12. Dry and itchy skin. Persistent skin dryness and itchiness may indicate more than just dermatological issues. Elevated glucose levels tend to pull vital fluids from the body, resulting in skin desiccation. Furthermore, excess cellular glucose has the potential to hinder the body's sebaceous processes, resulting in flaky, itchy skin. If you've experienced these dermatological symptoms and suspect a link to diabetes, it's critical that you consult with a medical professional. Let's proceed to number 11, necrobiosis lipoidica. Necrobiosis lipoidica is a skin condition associated with both kinds of diabetes. It occurs when our skin's collagen changes, causing the blood vessel walls to thicken. This is sometimes the first sign that someone has diabetes. If you notice symptoms and haven't been tested for diabetes, you should. It's also worth noting that those with celiac disease are more likely to develop this problem. Initially, necrobiosis lipoidica may manifest as little skin pimples. The skin may turn yellow or brown, and it may feel strange, thickening, or becoming shiny. This skin condition appears and disappears in stages. The affected skin region may become sore or itchy while it is active. While it is rarely severe, problems can occur. Number 10. Skin tags. Skin tags, also known as acrochordin, are small benign growths that can form on various regions of the body. A study published in the Indian Journal of Dermatology found a link between skin tags and diabetes mellitus. These forms can look like raised or flat pale moles or darkish spots. Skin tags are more common in diabetics, probably due to increasing blood sugar levels or increased insulin. While skin tags are not dangerous in and of themselves, they must be monitored. At number 9, digital sclerosis. Digital sclerosis causes thicker, tight, and fissured skin, particularly on the hands and feet. This disorder can cause joint stiffness, making activities like writing or simple hand movements difficult. As time goes on, this thicker skin can spread up the arms, legs, and even the back. Joint flexibility, particularly in places like the elbows, becomes significantly limited in severe cases. This ailment not only impairs physical well-being, but can also reduce one's overall quality of life. Though the underlying reason is unknown, people with a history of diabetes appear to be more vulnerable. Taking the number 8 spot, skin infections. Diabetes patients are more likely to get skin infections. Elevated blood glucose levels can weaken the skin's natural defenses, making it prone to dryness and cracking. According to an American Diabetes Association study, high blood sugar levels weaken the skin's natural defenses, making it more susceptible to bacterial and fungal invaders. As the skin's defense weakens, it provides a breeding ground for these germs, resulting in infections. Redness, swelling, little raised bumps, flaky patches, and sometimes even fluid-filled blisters are common symptoms. Number 7. Diabetic dermopathy. Diabetic dermopathy, also known as shin spots, is one of the most prevalent cutaneous symptoms of diabetes mellitus. According to a research published in the Journal of the American Academy of Dermatology, roughly 55% of diabetic patients exhibit indications of diabetic dermopathy at some point. These marks are distinguished by light brown scaly patches that primarily appear on the legs and feet, but can also be found on the thighs, torso, and arms. Although these patches are normally harmless, their existence may indicate poor diabetes care. At number 6, xanthelasma. Xanthelasma refers to yellowish, soft, flat, lipid-laden plaques, often symmetrically located on the upper and lower eyelids near the inner canthi. Their texture might be soft, semi-firm, or calcified. These plaques are simply cholesterol deposits beneath the skin. A study published in the Journal of Diabetes and Metabolic Disorders found a strong link between xanthelasma and diabetes mellitus, implying that they can be a cutaneous indication of underlying insulin resistance or increased blood sugar levels. Spotting the nail changes at number 5. Diabetes can cause noticeable changes in one's nails, including symptoms such as nail thickness, discoloration, and increased susceptibility to fungal infections. Diabetes can weaken the immune system, making it difficult to combat fungal nail infestations. One such worry is onychomycosis. Furthermore, diabetes can cause exceptionally dense nails due to decreased nail blood circulation or even neuropathy, which affects the surrounding nail muscles and tissues. Nail color alterations from mild yellow to deeper browns or even stark black might be seen. Number 4. Dark velvety skin patches or acanthosis nigricans. Acanthosis nigricans is a cutaneous manifestation of insulin resistance that is commonly found in people with diabetes or who are overweight. The skin is characterized by black velvety patches. According to research published in the American Academy of Dermatology, these patches occur due to an increase in insulin, which drives skin cells to reproduce at a faster pace. These patches most commonly form in skin folds, such as the armpits, back of the neck, groin, and elbows, but they can arise anywhere. Their existence frequently suggests an excess of insulin in the bloodstream, serving as a possible red flag for illnesses such as prediabetes or type 2 diabetes. Next on our list at number 3, blistering or diabetic bully. Diabetics may develop a strange illness known as diabetic bully, which manifests as large fluid-filled blisters on their legs and feet. Blisters are more common in those who have had diabetes for a long time. These blisters are thought to be caused by neuropathy or nerve injury, as well as poor circulation in the affected areas. However, it's important to note that not all blisters in diabetics are caused by diabetic bully. Blisters can also appear because of external factors such as physical friction or small traumas, and their occurrence may be heightened in diabetics due to decreased sensibility. At number 2, diabetic rashes. Diabetes, with its complex web of symptoms, can also appear on the skin as perplexing rashes. Despite their varied appearance, these rashes frequently serve as quiet indicators of shifting blood sugar levels. They may appear as reddish, irritated areas or as complicated patterns that itch or burn. While these skin eruptions are unsettling, they are important indicators of the body's panicked response to glucose abnormalities. Recognizing and treating these rashes as soon as possible is critical, not only for the health of the skin, but also as a signal to investigate one's blood sugar management. Claiming the top position at number 1, slow healing wounds. Diabetes' most concerning symptom is the extended healing period of wounds. According to a study published in the Journal of Clinical Endocrinology, excessive blood sugar levels can cause blood vessel degeneration, limiting adequate blood flow to damaged areas. This restricted flow reduces the delivery of critical nutrients and oxygen, both of which are required for wound healing. Diabetic neuropathy, a kind of nerve damage common in diabetic people, adds to the difficulty. This syndrome impairs touch senses, causing people to overlook or undervalue minor injuries, allowing them to worsen into more serious wounds. Furthermore, diabetes impairs the immune system's effectiveness, reducing the body's natural reaction to infection. Elevated blood sugar levels can also provide a breeding habitat for germs, increasing the risk of wound infection. And that's all for today. An enlightening exploration of the crucial skin signs of diabetes. How do you navigate and manage the challenges of diabetes? Please share your insights in the comments. Thanks for watching.